The fourth method, the transmission of Homeo Drug energy from a distance, was discovered by the Dr.B.Sahni of the Patna when he was living at the Bhagalpur. Late Dr.B.Sahni has a Newtonian thought like that. Everybody was knowing that apple is falling from the tree, but the Newton has thought why it should is falling on the ground. Like that, for the homeopathic medicine, Dr. B. Sahni was thinking that if the homeopathic medicines are in the form of energy, then energy is not essentially a thing or commodity to be eaten by mouth. Can you eat the energy? You all agree with this point that homeopathic medicines are in the form of energy. Then the Dr. B. Sahni was thinking that it is not essentially a commodity to be eaten by mouth. It can be transmitted, it can be transferred from the different media. Now, I will introduce how to transmit the medicine. First, the patient is told about the application, then the case history is taken in the most classical way, and the proper rubric is selected. Then the case is repertoried with the radar software or any other software, and then we select a particular medicine. A strand of hair is taken, either cut or uprooted from the head of the patient, and this is taken for the treatment. A selected medicine is put in the vial. You can see the vial, and this is given 10 times jerk with the inserted globules. Now this is called as transfusion set, and hair of the patient is ready to be inserted in that particular vial. Now, this is the real transfusion set. You can see the remedy name, the stepicegria, and the date and the name of the patient. When the hair of the patient is inside the vessel, that is called as transfusion is on, and when the hair is inserted outside, that is called as transfusion is off. The follow-up, progress, and homeopathic observation is made as by you. This is the real drug transfusion set of my real patients. Now, the follow-up, once I have inserted the particular hair of the patient in that particular vial, we should note the changes. And what are the changes? If there is no change, we can continue with the same medicine. If there is a positive change, we can wait for a certain time. And in case of aggravation, we can simply detach that particular hair of the patient and the aggravation is checked. There are the different changes. If sometimes you see the adverse effect after administering the hair, we can simply put off the hair and the aggravation is changed. Another advantage that in case of need of change of the medicine, you can simply put the hair out, wash it, and insert in another well selected particular medicine. Complementary medicine, inimical medicine, all we are following the same manner you are following in your oral method. Medicine used for the selection is selected from the general pool of the homeopathic medicine. There are more than 3,500 medicine in the homeopathy, and we use mostly the 50 millisimal scale potency. You can also use the decimal and centesimal scale potency. The advantage. So a question comes in the mind of homeopath when I talk about the drug transmission. What is the advantage when they are seeing the results good with their oral method? Why we need to take the drug transmission as a therapy? Then this is just seeing light by the frog from the pond. The first and foremost advantage, I have patient across these countries through the online consultant. I have more than patient from across 20 countries where the homeopathic medicine, sending of the homeopathic medicine is already banned. So we can just collect the hair of the patient and can start the treatment from our center. Another advantage, you see, in the case of homeopathy, when there is aggravation, till date, only method is to antidote, either with the coffee or something like that, or with any antidotal medicine. What is our observation? Just simply putting the hair out of the vial will check the aggravation. These are our observation. Other advantage, you see, Most of the time, homeopaths are following a very blind rule for the doses. Suppose a 31 medicine is given for the daily, 200 for the 1 week, and 1 m is for 15 days or for 30 days. There is no fixed criteria. These are the personal observation of the different doctors. In the drug transmission, until and unless this hair is inserted in the vial, there is continuous action of this particular medicine. These are our observation. Another, the very important misbelief we are finding in the society that homeopathic medicine are very slow. What I have given the 50 millismol scale as a rocket and the wheel like drug transmission to our patients. Another is, you see, many times a patient come to us and we are in the dilemma state that we can't find the exact remedy. In this case, what we can do, that we can simply plug the hair and restudy the case with the repertorize the case, and afterward we can insert that particular hair in that particular medicine. And the follow-up is, we can note by the phone, SMS, email, Viber, WhatsApp. Patient need not to visit our clinic very frequently. This saves the time and money. A very important thing, the vrat, the fasting, the Muslims Ramzan, they don't take the medicine from the Sahri to Aftar. This is the only system in the world, the drug transmission through hair, by which we can treat the patient without hurting the religious sentiment of the patient with the drug transmission method. We can treat the animals, as Dr. Makkar was saying, we can treat the animals without needles. Just by plucking the hairs, we can treat the patient. Many times we got a patient from the ICU where the allopathic doctors don't allow us to administer our medicine. At that cases, we can prescribe with the drug transmission method. Just pluck the hairs, and if you have a history of the patient, we can prescribe a very beautiful medicine. So what does Albert say about the drug transmission? I say same for the homeopathy. Try my method and fearlessly publish the failure. So a very obvious question comes in the mind, if drug transmission is such a beautiful thing, had Dr. Hahnemann ever advocated for such things? Yes. You have to perceive that. In the aphorism number 11's footnote, what is Hahnemann is saying? Only the dynamic influence. Hahnemann is talking on what is our homeopathic medicine? Only dynamic medicine, dynamic disease, and dynamic influence. Let's see. The dynamic effect of sick mapping influence on the healthy human being's dynamic energy is nothing any way material nor in any way mechanical. Our medicines are only the dynamic influence. Just as a piece of iron attracts the magnet. So you see what this is Hahnemann describing. Just by seeing a nauseous substance, there occurs the antiperistaltic movement in your stomach. Does that substance entered in your stomach? No. This is only the dynamic influence that Hahnemann is talking about. So now I am going to present you the cases. What is my purpose of presenting these cases? This is not just showcase. My purpose is the diverse disease and simplicity of the homeopathy. In this coming cases, I am going to show you the drug transmission acts in all type of cases, including acute, chronic, and very difficult disorder. I am going to present before you. Ureteric stone, if you can appreciate, the 27 mm ureteric stone has been cured by the drug transmission of Lycopodium 0/1. A case of folliculitis decolvans. Few of you might have seen this case of folliculitis decolvans. You can see the hideous picture of and this represents the exact picture of the mesarium which we can see in the Tyler Duck picture. The pus bleeds in the form of vermin at the scalp and making the thin crust. This is another case of folliculitis decolvans. A case of hair fall, you can see the different pictures. A case of psoriasis. Another case of psoriasis you can see in the different pictures. A case of wart cured by the Medorinum 0/1. A case of vitiligo cured by the Lycopodium. another case of vitiligo, a case of diabetic ulcer, 2 cases of diabetic ulcer, a case of psoriasis, a case of wart, a case of filaria. I am presenting the case filaria with a pictorial presentation in the different photographs. A case of ganglion at the wrist cured by the sulfur 0/1, a case of hepatomegaly cured by the China 0/1, a case of impetigo contagiosa cured by the natramure 0/1, granuloma cured by the acid nitric, a case of facial wart. You can appreciate the different photograph of facial wart, you can compare. Many cases of alopecia areata we have cured with the Calcutta 4 drug transmission. A case of seborrheic dermatitis, another case of impetigo contagiosa. So these are the different cases cured by us by the drug transmission through homeopathy. This is a very wonderful system of the medicine. Thank you.
Thank you very much, Dr. Singh. Thank you.
Thank you, sir.
All these medicines which you are trying to prove,
Yeah.
we can just take somebody's hair
Yeah.
and prove the drugs.
Yeah. But for that purpose, we have to use the double-blind method, which is advocated in the homeopathy.
I'm just giving a thought.
Yeah.
Second is, what about the present study being done on nanotechnology? Nanoparticles are present even in 10 cm. How those nanoparticles will be transferred by hair if the patient is in America?
To my understanding, nanoparticles, nanotechnology is the just materials in the medicine which homeopaths are trying to find. But to my understanding, homeopathy is dynamism. This is beyond the nanotechnology. You see, a nanoparticle can be found only from the particles, and homeopathy is beyond the particles. A nanoparticle is only found by the particles. We have the many drugs like silicea.
It's a thought.
Yeah.
I mean, just